Amcare is one of China's best-known premier private hospital group for women and children. About half of all babies born in Beijing's private hospitals are born at Amcare. We use InterSystems TrackCare as our electronic medical record system, and InterSystems Iris for Health powers our platform. For a hospital group, it is critical to get value from the rich data that we collect in our EMR, as well as other systems. Amcare Hospital Group values high-quality data that is comprehensive and accurate. We use data to operate our hospital before our InterSystems Iris-based platform went live. But all the data we handle manually. We need to prepare 2 weeks ahead with lots of manpower and resources consumed. Now all of the data, wherever it resides, can be automatically fed into our data platform with no need of additional workload, only business approval. We hope we can extend this platform to other healthcare providers to help them deliver better patient service so everyone can benefit.
And now, welcome to the stage, Alex Zuo, Head of Implementation at Amcare Hospital Group.
So, good afternoon, ladies and gentlemen. My name is Alex, and I'm currently working for Amcare Hospital Group as Head of Implementation. So it's my great honor here today having the opportunity to share some experience about how we are bringing data from TrackCare and other systems together to deliver actionable analytics. So, before we focus on what we did and how we did it, I'd like to spend a couple minutes to give a brief introduction about who we are. And hopefully that will help you guys understand why we have such a strong driven to build a data analytic platform based on Iris for Health. So as our CIO just mentioned in the VCR, Amcare is one of the leading private hospital groups in mainland China. We have 7 hospitals located in Beijing, Tianjin, Hangzhou, and Shenzhen. Well, from the north to the south, so 1,000 miles away from each other. And we have 3 clinics, and we also have 4 maternity care centers. So we are not huge general hospitals. Amcare mainly focuses on gynecology and obstetrics, pediatrics, assisted reproductive, and orthopedics. Sorry, that's orthopedic. Well, I don't know what happened. So I like to use 3 keywords to describe us. So high-end, chain operation, and that. Again, I'll say it. So that's collectivized management, group management. So that 3 keywords leads to 3 key demands. Amcare really aims to provide a high-end service to our customer to deliver a customized, patient-centered service experience. And we are highly chain operated, which means we need to make sure all the hospitals across China are strictly following standard SOPs in delivering the clinical service. So one hand, we need to be customized, and on the other hand, we need to be highly standardized. And we also maintaining a high collectivized management mechanism, which means we need to crystallize subsidiary hospitals' operation. We need to know them. We need to know as detailed as possible to make the right daily management decision. So, we build our system accordingly to meet those key demands. So we need a CRM system to help our staff to get closer to the customer with digital tools inside and outside the hospital. So we self-develop our CRM system from the ground. I talked to a couple of new friends last night during the dinner. So for our demand for CRM system in healthcare industry are extremely special because the product we are trying to sell in CRM system are not just normal goods. They are actually our service, clinical service, that stands for our clinical contents over there. And the customers, the service we provide through CRM are also unique because every patient is different and they have different health status, different needs. So the service needs varies a lot. I mean, they are different from one to another. And there are a lot of things that we cannot simply go discount, right? Like drugs, like tests. So that's pretty complex. So we need to build a CRM from the ground by ourselves. But that's another story, so that's not a focus for today. And we also need a very powerful EMR system like TrackCare, so we choose TrackCare, to closely align to the business so that to use the system means to follow our management SOP. And we also need a system to provide precise, comprehensive, and real-time reprocessed data according to our managerial request. So here comes to that's a general IT structure for Amcare. So we take TrackCare as the core and have our whole structure. We call it 5-to-1 structure. We have 5 main systems over here. At the center, we have TrackCare for our clinical service. In the client-facing side, in the front, we have CRM. On the back end, we have management operation, we have ERP. And above all systems, we have a data analytic platform based on Aries to gather all the information and reprocess the data to provide the data to our, support our business decision. And on the bottom, we have an SOA platform to handle the information exchange and distribution between different systems. So that's our 5 systems. And we also have 2 approaches. The data security is for software, hardware, network, server data to make sure that our data is secured. And we got a standardization approach, mainly focused on business SOP and technology SOPs. So that's the 2. And the last one on the very bottom is the foundation. We have a hybrid cloud infrastructure. All the system Amcare has right now needs to be implemented on our hybrid cloud infrastructure. So that's our overall business IT structure. All right, so after implementing the whole structure, we spent another 5 years fine-tuning between different teams to make sure that our daily operation and our system can smoothly integrate it. So relying on TrackCare's powerful product capability, now we have a constantly optimizing system. And at the same time, we also have a shifted working pattern. Now our staff can rely on system to consolidate operation and make decisions instead of just, talking like paper forms, like, policies, like face-to-face communication. Combined with these 2 together, the ultimate goal for our IT department is to reach a status we call system alignment. That is to say, we want every step in the business process, or at least every step of those important business process, has a system function to compare with. So to use the system means you are strictly following our management concepts and our SOP. So what this system alignment has brought to Amcare? Well, I'll take an example. In 2019, August, we acquired a hospital, which by that time, that hospital couldn't even afford a salary. So let's call it Hospital X. We spent 3 to 4 months to switch all the system to ours. And then the COVID came. It's a bad timing. But anyway, so after 6 months, the Hospital X reached the turning point and started to make profits, even under those, bad overall circumstances. So maybe that's partially because from the day one they started using the system, they became an Amcare hospital. Because all the SOPs, all the policies, all the concepts I mentioned above are consolidated in the system. So it significantly lower our management cost. We do not need to operate the hospital by human beings. We just need to make sure that they are strictly using the system. More than 90% of their former employees stay. Which means they're basically still the same team to operate the hospital, but the results are totally different. So I'm using this kind of, this one as an example, trying to show that what this kind of system alignment or what kind of, change TRICARE and IRIS has brought to us. So right now, that's up to now, the last month. So the revenue almost doubled by the end of last month. So I think for now, everybody might have a whole picture about who we are and our overall IT structure. So, to make a business decision for a group hospital like us sometimes can be extremely hard because, those hospitals are 1,000 miles away from the office. And we need to make sure that, we make the right decision. So in order to do that, we need to learn to let the data talk instead of human communication. So that's why I want to share a little bit about how we are using InterSystems IRIS for Health to deliver or to drive value from disparate data. So let's look back to our 5-2-1 structure. These 5 are only our main system. We have a lot of small system also, but not mentioning here. So data scattered in different systems. And I think all peers sitting here today might experience the same occasion every now and then, that the same number varies in different systems. For example, if we want to see the outpatient visit number, that number might be different from EMR to ERP. That's not the fault of system. It's just because every system has their own perspective, right? So we need to drag all the data to our data analytic platform and to make it the one and the only source for our management team. And then to reprocess the data according to their management request. So that's why we are doing this. And this here is how we do and what we need for management. Things we need our data analytic platform to be the only source to support our daily decision. We need our data platform to be comprehensive, to be precise, to be real-time and stable. Data generated from all different systems needs to be collected and stored on IRIS. And then we need to provide high accuracy and reliable data to become the only source to support data-driven operation decision. And the data needs to be real-time and stable. By saying it needs to be stable, I mean sometimes like the revenue for last month. It needs to be stay in the system like what it is. If maybe a refund happened for last month, but happened in this month, the number changes for this month, but the revenue for last month always stay as what it is. Your revenue cannot change from time to time, right? For your previous revenue. So, but we also need IRIS to provide us real-time data. Like for example, if I want to see the waiting, how many people are waiting for ultrasound. So the system needs to provide us a real-time data. So IRIS is really a powerful tool. It scales without sacrificing the performance and help us to do that. Without it, we cannot build a data analytic platform from the ground by ourselves. So, but our data analytic platform is itself, we need to meet our management requirements. So it's capable of, there are 4 things. What happened to the last one? Anyway, so data indexing. So the system allows us to create different index topics or dimension or measures according to management demands instead of just storing raw data. The system changes them into index under our business definition. And we clearly identified series of services it provides. So instead of allowing other systems to use Circle for inquiry, data platform encapsulated as service for internal and external system to invoke. Because we have CRM, we have ERP. So we all need the result, the data from our data platform. And every single index can be dated back to the original system and related to the action that generated data. Later, I will give you guys a scenario and hope that scenario it will give you guys a more intuitive understanding about how we relate subjective data to objective data. So I will just expand that later. And the use of different data can be fully monitored by the platform. And the last one is statization, because we store data, our data are managed according to catalog arrangement. So they exist as assets and can be monitored in order to understand how they are used, by whom, what the utilization rate, and how much value they generate. So let me show you a scenario. At Amcare, we have monthly operation meeting every month. And that's for a time for all director level and above employees to have a systematic data review for every hospital. So during that monthly operation meeting, we will try to identify problem and find solution using our data platform. So I will, in this scenario, we will have Lucy here to help us. So Lucy will be our quality control director for this scenario. So I will handle the stage to Lucy.
Okay. Good news for everyone. You won't see this nice code on this because we have already recorded this as a video. So I'm adding some translations on the video so that you guys can read because the original ones are in Chinese. Okay, so I'm the quality control director from Amcare. I will have our monthly meeting in the next day. And before that, I want to check the data dashboards on my cell phone so that I can be prepared for the meeting. Here, after I log on, I can see the main menu of all dashboards I can view. I click on the corporate view, and it shows me all the high-level data that we have as a corporate. And it has the revenue data and operation data as well. We have the outpatient visit number, the newborn baby number, and the procedures we are going to have for today, and for this month, and for this year. And if I want to see more, I can click the more and to show more data of this specific section. Here, I can see there's a lot of numbers on this view because we are having this as a real-time data, we can have the achievement rate for each category. And I can see this by day, see the numbers for the previous days. And I can also change the view to see the month and the year. Yeah, then I go back. This is the corporate view. And as a quality manager, I need to see these indicators for the quality control. We have the long patient waiting time by each hospital. We drag this data from our patient survey after their each visit. And we divided this by hospital and by each month. And from here, I can see there's the number is raised really high for hospital D in last month. And I wonder what happened to this hospital. So I need to handle this immediately. I need to go back and check on the overall operation dashboard for this hospital. I click on the hospital view and check on this hospital D. And again, this shows me this revenue data, the sales data, and everything in this one menu. And the achievement rate seems fine by me. We are ahead of our schedule. And I can switch to the year view and see the trends for the revenue in the past few months. Okay, and then I got to see the visit number as from the outpatient clinic of this hospital. And we can see in this hospital today, we have an OP appointment reached more than 300 today. But we managed to handle it, most of them. And then I have the same amount for tomorrow. So at this point, from my cell phone app, I can see this data looks good to me, but I still have this concern about why we have a higher patient complaints for the hospital D. And then I will handle this issue to Alex to do more analysis on his laptop.
So now the time comes to the day for the monthly operation meeting. Again, all the data here I'm showing in this scenario are real data, except the revenue. Okay, the revenue are fake. We are not showing revenue here. But all the other data you're gonna see here later in the scenario are all real data based on, is from our daily operation. All right, so I will firstly run a double check for the quality indicator from PC. I found that for last month, Hospital D did have a really high long patient waiting complaint rate. It's already more than 15%. It's higher than itself, and it's also higher than any other hospitals across China. So I will use the analyzing tool to find out why. This is also based on Iris BI function. So we got a lot of dimension and measure here on the left. So we will just pick the long patient waiting time and drag it to dimension. Just simply, pick and drag. Then we will have, I want to show the rate by time, so I select the survey rate. So here we will see that's the complaint rate by year. Then I will use the filter to find exactly hospital we want to see, the hospital D. Then here we have hospital D's long waiting complaint rate by year. I click the number and narrow down to by quarter. The third quarter is 13%. I further drill down to July and August. So because that's the real data, so for July, our hospital D complaint rate was 15%. So that's pretty high. I mean, we need to fix out. So then I need to see more detail. So I can choose specialty, add specialty dimension to the month. Then we will see different rate by specialty. Then we will have the assisted reproduction department have reached also almost 20%. I need further insight to see what happened. So I choose the doctors as a new dimension. And now we have the complaint rates by doctor under the department. We can see Dr. Chen has the highest rate for 35%. So until now, here are all subjective data. We need to find some objective data to support, to find a reason. So here is all the objective data from TRICARE. So that's all the patients Dr. Chen see for the last month. And the average waiting time over there are almost more than 100 minutes. So that's the real data from TRICARE, from the point that our patient arrived at the nursing station until they enter the doctor's room to see the doctor. So that might be some problem because the waiting time is too long. I mean, that's all true data. It's too long. So then we need to figure out what happened for Dr. Chen. So here is an analysis for Dr. Chen's outpatient visit. For the past 12 months, that's the every month, how many outpatient visits Dr. Chen had provided. From the beginning of this year, the average outpatient daily visits is around 35. And then as the time goes to April or May, the number reached almost 60. And for July, the number reached almost 80. And more than 10% for her daily outpatient visit were first-time visit. So that costs longer time. So Dr. Chen was providing more services and was extremely busy. I mean, being a doctor in China. So it's more than 80%, more than 80 visits per day. And to our understanding, the more service you provide, the more the revenue you should generate. But we hide the generate, just only leave the line here. So, but as she provides more services, the long waiting compliance rates raised, but the revenue decreased. So that's something we start from a long patient waiting time, and then we drill down to objective data and to an operation status. So we need to really find a balance between the volume we want our physician to provide and the experience that we want our patient to have and the revenue we want to get. So here, when we have this kind of data during the meeting, we will have something to talk about for our management team to adjust their daily operation to reach a better result.
Yeah. So at this point, I think as a quality control director, I need to feedback the same result to Hospital D and asking them to find a balance between the doctor's workload and patient service standard in order to provide a higher standard service to our patients. And that's why, that's how we drive this patient complaint data from patients is objective, and we managed to connect this with our actual TRICARE visit data, and that's subjective. And that's how we drive value from the data we have and put it all together to get our operation.
So once again, I mentioned those are all true data. So if you guys still remember, for the third quarter, for July, our complaint rate was 15%. But on August, it drops to 10%. So that's exactly what we did during the monthly operation meeting. We find problem from the data, try to identify the problem through the data, and use the data to solve the problem. And then we will verify what we did to see the results, again, from the data. So the scenario might not be so fancy, but the daily operation for a hospital will be very complicated and the tons of work. So I'm trying to show here is how we use the data analytics platform based on Iris to solve our real world operation question here. So that's all for today. Thanks for Lucy, and thanks to everyone's time for my sharing.
Thank you, everyone.